Hello friends, today we'll learn the general morphological features and the attachment of clavicle. We will first quickly revise the side determination of clavicle. Clavicle is a long bone, so it contains two ends. This is the medial end and this is the lateral end. Medial end is somewhat truncated and quadrilateral, whereas the lateral end it is flattened superior inferiorly. The lateral end on its inferior surface presents two elevations. This is the tubercle and this is the ridge. So this is to be kept inferiorly. Now, clavicle in its medial two-third it is convex anteriorly, whereas in lateral one-third it is concave anteriorly. So, by combining these three features, we can conclude that this clavicle it is of left side. Now, we'll move towards the morphological features of clavicle. Now, we'll start with the medial end of the clavicle. Medial end it is truncated end, and while observing it from the medial side, we can see that this is the facet where it will articulate with the clavicular notch in the sternum, and the posterior superior portion of the medial end it is rough and it provides attachment to the fibrocartilaginous disc of the sternoclavicular joint. Now we will move on to the shaft of the clavicle. Shaft of the clavicle is cylindrical in shape, and while observing the shaft from its inferior surface towards its medial end, the shaft presents a facet, and this is for the attachment of a ligament over here. Moving lateralwards in the middle of the shaft, it presents a shallow groove, and as this groove is present on the inferior surface of the clavicle, it is known as the subclavian groove. So this is the subclavian groove. Moving further lateralwards on the inferior surface of the lateral end of clavicle, there are two markings present. The first is a tubercle, and this tubercle it is known as the conoid tubercle, and this is the ridge, and the name of this ridge is the trapezoid ridge. On its lateralmost aspect, the clavicle bears an oval facet for the articulation with the acromion process, and thus clavicle will form the acromioclavicular joint with the acromion process. Now we will learn about the attachments of clavicle. We'll start with learning the attachments from its medial end. In order to understand the attachments of the medial end of clavicle, we need to focus on this diagram. Now, in this diagram, it has been shown that this clavicle is attached to the manubrium sternum on this clavicular notch, and just below the clavicle there is the first costal cartilage. So the medial and under surface of clavicle it is attached to the first costal cartilage by this ligament, and as this ligament is connecting clavicle with the costal cartilage, it is known as the costoclavicular ligament. And on the medial most end, this clavicle it is attached to the another clavicle of the other side by this ligament, and as this ligament connects both of the clavicle, this ligament is known as the interclavicular ligament. We'll get back to the clavicle. This is the medial end of clavicle, and this facet is for the sternoclavicular joint. Around this facet, over this line, the capsular ligament of the sternoclavicular joint is attached. On the superolateral aspect of the facet, there is the roughened area, and over this area, the fibrocartilaginous disc of the sternoclavicular joint is attached. On the inferior surface of the medial end of clavicle, over this facet, the costoclavicular ligament is attached. Now we will learn the attachments of the shaft of the clavicle. In order to understand the attachments of the shaft of the clavicle, I would like to show you another diagram. In this diagram, I have shown several muscles which are in relation with the clavicle bone. This is sternocleidomastoid, this is pectoralis major, this is deltoid, and this is trapezius muscle which falls posteriorly. So we can see that sternocleidomastoid is in relation with the superior aspect of the medial end of clavicle, whereas pectoralis major muscle it is in relation with the anterior portion of the medial half of the clavicle, whereas deltoid and trapezius they are in relation with the lateral half of the clavicle anteriorly and posteriorly respectively. So that from this diagram we can see that these are the relations of the aforementioned muscles. Now we'll get back to the clavicle. So in clavicle, this is the area which is the superior surface of the medial end of clavicle where the sternocleidomastoid muscle gets attached, and over the anterior border on the medial two-third of the clavicle, pectoralis major muscle gets attached, and over lateral side, lateral one-third, anterior border, deltoid muscle gets attached, and lateral one-third, posterior border, trapezius muscle will get attached. Now we'll learn the attachments of the inferior surface of the shaft of the clavicle. On the inferior surface, there is a groove present and the groove is named as the subclavian groove. There is a muscle attached to this groove and because of its location, the muscle is known as the subclavius. Over the lateral and inferior surface, there is this conoid tubercle and this trapezoid ridge. Over both of this structure, there is a ligament attached and the name of that ligament is the coracoclavicular ligament. And conoid portion of the coracoclavicular ligament is attached to the conoid tubercle and trapezoid portion of the coracoclavicular ligament is attached to the trapezoid ridge. On the lateral end of the clavicle, this is the facet for the acromioclavicular joint, and around this facet the capsule of the acromioclavicular joint is attached. So friends, this was the morphological features and the attachments of the clavicle. I hope you like it, and if you have any suggestion or comments, please put them below. Thank you for watching the video.